Your feet are engineering marvels that quietly carry your entire body, absorb shock, and keep you balanced. Yet they're usually ignored until something feels wrong. Numbness or tingling may seem harmless at first, like a foot falling asleep. But when it lingers, it's often your body sending a warning. Knowing why your feet are so sensitive and what numbness really means can help you catch problems early, before your most loyal body parts decide they've had enough. Why human feet are so sensitive. The feet are among the most sensitive parts of the human body. Each foot contains thousands of nerve endings connected to the nervous system, constantly sending sensory information to the brain. These nerves allow you to feel subtle changes in surface texture, pressure, temperature, and movement. Without this feedback, even simple actions like walking on uneven ground would become risky. This sensitivity exists because the feet are in constant contact with the external environment. Unlike the hands, which can be withdrawn quickly, the feet must continuously adapt to changing surfaces while supporting the body's full weight. Sensory receptors in the soles help detect heat and cold, allowing the body to react instantly to potentially harmful surfaces. They also play a major role in balance, posture, and coordination, helping prevent slips, trips, and falls. In simple terms, your feet act like highly specialized sensors that keep you upright and safe without you consciously thinking about it. What happens when sensation is lost? Because the feet are so dependent on nerve feedback, numbness can create serious functional problems. When sensation decreases, balance becomes less stable. You may feel clumsy, unsteady, or unsure of where your foot is landing. Over time, this can affect posture, walking patterns, and confidence in movement. Numbness does not always mean complete loss of feeling. It can appear as tingling, pins and needles, burning, prickling, or a sensation similar to being lightly poked by needles. Some people describe it as wearing thick socks when they are barefoot. Others feel weakness or heaviness in the feet, making walking more tiring. These sensations are not random. They reflect changes or disruptions in how nerves transmit signals between the feet and the brain. How to spot numbness in the feet early. The most obvious sign of numbness is reduced sensitivity. You may notice that surfaces feel dull, muted, or different than usual. Temperature changes may be harder to detect, and pressure may feel uneven or delayed. Over time, this can affect balance, making standing or walking feel unstable. Beyond loss of sensation, there are other warning signs to watch for. Tingling without physical contact is common, as is a prickling or crawling sensation beneath the skin. Some people experience sudden sharp sensations or mild burning. Weakness in the feet may also develop, making it harder to lift or control foot movement. Paying attention to these early changes is important. Even mild or intermittent symptoms can help healthcare professionals identify the underlying cause before the problem worsens. What causes numbness in the feet? Foot numbness usually originates in the nervous system. Nerves can be irritated, compressed, damaged, or deprived of adequate blood supply. In some cases, the issue is temporary and harmless. In others, it signals a chronic condition that requires medical attention. Temporary numbness often occurs after sitting or standing in one position for too long. This posture can restrict blood flow or compress nerves, causing the feet to fall asleep. Once movement restores circulation, sensation usually returns quickly without lasting effects. Chronic numbness, however, is more concerning. It may result from long-term nerve damage or systemic conditions. Problems affecting the spine, such as herniated discs, can compress nerves that travel down to the feet. Long-term alcohol use can damage nerves over time. Metabolic conditions like diabetes can slowly impair nerve function, particularly in the lower extremities. Other potential causes include inherited nerve disorders, inflammatory conditions, infections, circulatory diseases, and nerve compression disorders in the foot itself. Injuries to the spinal cord or peripheral nerves can also disrupt sensation. In some cases, damage to blood vessels reduces oxygen delivery to nerves, leading to numbness and pain. The role of circulation and blood flow. Nerves rely heavily on healthy blood flow. When circulation is compromised, nerves do not receive enough oxygen and nutrients, which interferes with signal transmission. Conditions affecting blood vessels can therefore contribute to numbness in the feet. Reduced circulation may cause the feet to feel cold, pale, or weak. In advanced cases, pain may appear during walking and improve with rest. Poor blood flow also increases the risk of wounds healing slowly, which can become dangerous if sensation is already reduced. This combination of nerve impairment and circulation problems makes foot numbness particularly serious in certain populations, especially those with long-standing medical conditions. When foot numbness becomes an emergency. While many cases of foot numbness are not life-threatening, certain symptoms should never be ignored. If numbness spreads beyond the feet to other parts of the body or appears suddenly and intensely, it may indicate a neurological emergency. Warning signs include dizziness, confusion, difficulty speaking, or problems breathing. Loss of bowel or bladder control, severe headaches, or sudden weakness can also signal serious issues. When numbness is combined with these symptoms, immediate medical attention is essential. In some situations, foot numbness may be linked to conditions such as stroke, seizures, or transient ischemic attacks. These events require urgent evaluation and treatment to prevent permanent damage or life-threatening complications. Why diabetics must be especially careful? For people with diabetes, numbness in the feet is particularly dangerous. Chronic high blood sugar can damage nerves over time, reducing sensation and pain awareness. This means small cuts, blisters, or injuries may go unnoticed. Without proper care, these minor injuries can worsen, become infected, and lead to serious complications. Reduced circulation can further slow healing, increasing the risk of ulcers and long-term damage. Regular foot checks, early detection of numbness, and prompt treatment are essential for preventing complications in diabetic individuals. Ignoring early symptoms can have severe consequences. How foot numbness is diagnosed. Doctors diagnose foot numbness by combining symptom history, physical examination, and diagnostic tests. They may check reflexes, muscle strength, sensitivity to touch and temperature, and circulation. Depending on findings, further tests may be recommended. These can include blood tests to detect metabolic issues, imaging studies to examine the spine, or nerve conduction studies to assess nerve function. Identifying the root cause is crucial for effective treatment. The goal is not just to relieve symptoms, but to stop progression and prevent permanent nerve damage. Treating and managing foot numbness. Treatment depends entirely on the underlying cause. For temporary numbness, simple movement and posture changes are often enough. Standing up, stretching, and restoring circulation usually resolve the issue quickly. For chronic cases, managing the root condition is essential. Regular physical activity that does not irritate the feet helps improve circulation and nerve health. Low-impact exercises such as walking or swimming are often recommended. Foot care plays a critical role. Inspecting the feet daily for cuts, blisters, or wounds helps catch problems early. Wearing well-fitting, supportive shoes reduces pressure on nerves and protects the feet from injury. Avoiding tight footwear and maintaining good hygiene also contribute to nerve health. In some cases, medications, physical therapy, or specialized treatments may be required to manage nerve pain and prevent progression. Protecting your feet for the long term. Healthy feet support independence, balance, and mobility throughout life. Paying attention to changes in sensation is not overreacting. It is proactive health care. Numbness is not just an inconvenience. It is a message from the nervous system that something is not functioning as it should. By understanding the sensitivity of the feet, recognizing early symptoms, and responding appropriately, you can prevent minor issues from becoming major problems. When it comes to foot numbness, early awareness and action make all the difference. Your feet carry you through life. Listening to what they are telling you is one of the simplest and most powerful steps you can take toward long-term health. If you found this video helpful, make sure to like and subscribe for more clear, science-based explanations that help you understand your body better. like, and subscribe, and stay informed so you can take better care of your health every day.